Jordan, if I emailed something to you that I'd like for us to go over, and you would have information.
Run next door.
We did have or last one. So it's now 6:38. And let me just see. Two people may come in a little later who represent a quorum, for us in person. And if so, then we can actually vote on materials. But I never like to cancel because of presentations that may be, forthcoming. Fortunately, we got most of our West Harlem Development Corporation presentations in before last month. Actually, I think it was before last month. And tonight, though, we have Public Health Solutions here for a presentation. And just yes or no for now, are you one of the WHDC grantees, West Harlem Development Corporation grantees? It's another reason that you guys, yeah. Okay, so we did get all of them in. So at 6:38, we are starting the meeting, and I'm sure we will not have as long a meeting as we would ordinarily have, because we're in a funny position in that this weekend might ordinarily be Memorial Day weekend. For a lot of companies still, the weekend, it's just the way that this June 1 has fallen. So some people are away and did go away for vacation. And let's see who. Probably arts and culture. Are you arts and culture? Next door, but they canceled, I understand.
Wow.
Yes, Heather. So we all just have for the meeting has started. Our meeting has started.
Oh, I'm sorry.
But you can come join us Sunday if you. But that meeting has started. But you're cannabis committee, so you can join us if you want. Is Monique back in town?
He should be.
She should be. Okay, so you'll get a chance to see Monique.
Oh, Monique. Yeah.
I know she was out the weekend.
Yeah.
Okay, so
I'm gonna
so anyway, we have at least another community board member here with us, and so we have gotten started.
I'm gonna stay for a
6:38.
little bit, okay?
Okay, just welcome, Heather.
Hi, sorry I'm late. I'm still at
Yeah,
work.
but you're always before
Okay.
6:40, so you're good. You
to go
are
home today.
consistent. But we have started, and that's Jordan on Zoom with us, Christopher Johnson on Zoom. He's with Emma Bowen, and then we have Marie, who I love the way she spells that, but anyway, Marie from Public Health Solutions with a presentation as well. But so what I want to do, and I'll correct this. I printed this without going to the internet to find out what awareness month it is. And I recall very clearly that I got a call. I was on the internet and then got interrupted and just didn't complete that part. But there is some awareness, I'm sure, that's taking place this month. And for the formalized printing that will go with the executive committee report, I'll find it and replace, with the actual number of areas of the body or concerns that we should have related to health awareness. Meanwhile, we still don't have a quorum to. Hello? Excuse me. Yes, I'm here. Yes, Brian, I do need to talk to you, and this is a committee I'll mention you to. Um, but at any rate, can I call you back in about an hour and a half? Okay, thanks, Brian. Okay, bye-bye. He is absolutely the person, one of the people I want to talk to in reference to this meeting. Um, but anyway, I'll call him back. Um, so for the agenda this evening, we'll have a short meeting. We'll hear from Public Health Solutions. Um, I haven't seen our liaison from Department of Health and Mental Health the last couple of months. And we're very grateful to her, but there are times when we want to hear from her. And I know a lot's going on, and so we're going to try to see what's happening and with Department of Health, Mental Health, Hygiene. Um, and then I do want us to, after we hear from Public Health Solutions, maybe by that time we'll have a quorum and we could just go over the minutes, which are really not completed, but it gives me something to go on and we can okay them before the executive committee, since I don't want to have to deal with this over the summer. As well as whatever we discuss at the June, today's meeting as well. And then there are a couple of other nice things that I'll just bring up, and I want the committee's involvement with that. So, we'll forego adopting the minutes now until we get an actual quorum, as well as adopting the agenda. But, at least we have what we have. At that note, okay, so Marie, so that we don't hold you too much longer, do you need to be made a co-host to talk about public health solutions and the Medicaid program?
I don't think I need co-host ability. I should be able to do this without slides. It's just a general conversation about what we do. So to start, I do have if you want to see the slides, you can. But
You're welcome to. You have half the committee who can see it, and that's always good.
okay.
When you say, do we want to see them, like email them to us or show them, make you co-host?
I can show them
Let me
maybe
make
I
you
have
co-host.
ability.
There.
Can you see now?
Sure.
Yeah,
They're not coming through right now. It's this code. Yes, now we can.
Okay, now we
Yep.
have them. Oh, yeah.
Okay. Is it in? Sorry, I'm
You-
trying to see if it's in presentation mode or not.
Not a presentation mode. So you need
Okay, thank you. Let's see. There we go. Okay.
Yeah,
So
sure,
just
now
Oh, there it goes. Yeah, very
to
nice.
start, in 2022, we launched Whole U NYC as a citywide network to help people get access to social services. And then in 2024, we were actually awarded a grant to help people do that even more with Medicaid members. And that was the 1115 Medicaid waiver. So the 1115 Medicaid waiver essentially believes that if you give people the resources that they need, we can lower health costs. If people have the right grocery stores, if people have the right transportation needs and housing is safe, all of those things do contribute to our health. So as for our community engagement team, we operate generally under a no wrong door approach. And that just means that we are trying to be everywhere all of the time. We're visiting community boards, we're at community events like health fairs, anywhere that people gather. So faith-based institutions, especially going to food pantries, all those places. And I know I'm going kind of quickly, but I do want to have time for discussion.
You'll have time.
Okay, thank you. Namely, the community partners and community events are where we are most present. We're also on social media, as is everybody, of course. But so the social care network operates under a method of screening to navigation. So we start with a screening of the Medicaid members, and that is a 12-question survey to address what their needs are. It asks things like, do you have stable housing right now? Is your housing safe right now? Do you ever run out of food before you have the ability to buy more? Have you ever not been able to make it to work due to transportation limits? Those sorts of questions, just to get in. Yeah, of course.
We have a meeting going on right now, but arts and culture is canceled. Maybe there should be a note on the door.
I don't know if that's what we.
I don't know if you want to put a note on the door for keys. You're welcome to stay here since you're here. I know your face. We just have a meeting. We don't want to interrupt her presentation too much.
Sorry.
You are very welcome to be here. Okay. And you sign in for your credit of that too. Okay, Marie. And Marie, you have to speak a little louder because
Speak louder,
we're
okay.
very close to a overground subway.
Okay,
Yeah, above
got it.
ground
I can be louder.
Yes, that's gonna be helpful.
Definitely. So back to it, we start with a screening of the Medicaid member. It's those 12 questions I mentioned. It goes through things like housing, nutrition, and then transportation, and also the member's safety in their home and with their family. And our goal really by the end of March 2027 is to screen all 2.6 million Medicaid members in our area. And our area covers Manhattan, Brooklyn, and Queens. So we have 3 boroughs to think about, 3 boroughs of people to reach. It is a lot of people, and we're trying to get all of them services by the end of March 2027. Once they've completed that initial screening to see what their needs are, we send them to navigation and they do a brief eligibility assessment. The eligibility can be very broad, even if they don't qualify for some of those enhanced services like rental arrears and assistance, then we can get them level 1 services. And that navigation tracks and reports to any unmet need. So if we flag a need for housing in their initial screening, that's where the navigation comes in and we refer them to someone in our network. Our network is 250 different nonprofits that provide these services. These are what the enhanced services look like. So from care management is just organizing what their referrals will be. And then for housing, that's our most broad kind of service, like medical respite, asthma remediation. That's like if there is something affecting someone's asthma in the home, if it's mold or whatever, we clean it out. Any home accessibility modifications, if a client needs grab bars installed, any safety modification. And then when it comes to rent or temporary housing, we can do transitional housing from shelters, find them an apartment, get them set up with all the pots, pans, furniture that they might need, and then pay that initial security deposit and help them with up to 6 months of rent support, and then also 6 months of utility support. If they do have stable housing, but they're having trouble paying those bills, we can support up to 6 months of back rent or 6 months ahead in rent. And the same thing also for utilities. Then when it comes to nutrition, it's largely pantry stocking or referrals to pantries. If the patient has a mobility issue per se, they might not be able to get to the grocery store with a voucher, we can have those groceries delivered to them. If they're not able to prepare meals for themselves, we can have medically tailored appropriate meals prepared for them. And then transportation is non-medical transportation because their health insurance companies do cover the medical transportation. So that would be either an Omni card or an Uber voucher if they're having mobility issues. The eligibility for those enhanced services comes with these 3 parts. One is that they are enrolled in Medicaid managed care, and that's because the MCOs are what fund and cover the cost of the program. So that's Anthem, Health First, Fidelis, whatever MCO they might be a part of. The second is that they do demonstrate an unmet social need, so there is a reason for this service to be provided. And the third is that this is the big one, that they're an enhanced service population. So this is something we can be flexible with because they may not be enrolled in a health home, but they do have a chronic condition. We can get them enrolled in a health home the same day and make them eligible. I'll go through the list. The first is that they're a Medicaid high utilizer. That's if they are in and out of the emergency room. I think it's up to 4 times in the past couple of months. Anyone enrolled in a health home, that's where the most flexibility is. Anyone with a substance use or mental health issue, anyone with intellectual or developmental disability, pregnant and postpartum persons, and that is up to a year postpartum, regardless of the outcome of the pregnancy. And it's also entirely client-based, so you would not need a medical attestation saying that you were pregnant. If you claim that you were pregnant, that is the claim. And then post-release from incarceration, and the last one being high-risk youth. So,
Did everyone understand what health home is?
The health home.
Yeah,
I'm assuming that it's, you know, a service that they provide personal, care for. Through,
that's pretty close. Can you say more about just the structure of the health home?
yeah, so the health home is actually not by Public Health Solutions, but it's a separate entity. They essentially manage people with chronic care conditions. So if you have a chronic condition, you might need to have a lot of different doctor's appointments with a lot of different providers. And the health homes are the people that help you schedule those appointments, help you manage your care with all of your providers, and just kind of streamline the process for you.
So the structure, as I recall it, is there's a major healthcare institution that organizes a number and coordinates a number of other healthcare institutions under it, so that the reporting comes to that main body. Like Heritage had a health home, because I got the grant for that one, so but we're talking like maybe 10 years when they first got, we were one of the first. And so we became a health home, and we had about 100 what we call the partners, but 100 other, as Marie said, they could be from housing, they could be from small clinics or large clinics, but they the whole thing is to have a number of clients that need care because they are in a chronic situation in terms of their health. But instead of sending them around or having them search for 150 or 50 or 100 different other outfits or resources, they come to that one, and that one health home is called the health home, led by one entity. They would direct them, help schedule them to appointments, find housing and all. So that was a new concept at the time, and it's remained. I'm not sure how many health homes. It's founded by the state. So
Yes.
sure how many are in the state system now, but they started out with 5 health homes, and then it grew and then grew and grew. So it seems to be pretty effective, but it was, it took time to organize those. So I just want to say it, because sometimes you say health home, and I can tell people hear it, but they may not be dissecting it. Okay.
Yeah, exactly. Thank you for that. Were there any other questions about the eligibility criteria while I have it open?
There were 3, you said housing, nutrition, and what was the other one?
Transportation.
Okay.
And you mentioned managed Medicaid, I guess, so straight Medicaid recipients would not be eligible for the enhanced services or not?
Fee for service, no. Or like emergency Medicaid, no. Those we could still refer to our level 1 services, which are more geared towards things like SNAP and WIC, programs that already do exist through the government opportunities, so that we can still offer them help, or we can send them to other nonprofits that we know will be able to provide the service. It just won't be a referral directly from us.
There are some big changes, as I understand it, and I don't want to get ahead of you, but I understand as of now, because of changes in federal government, it's going to be quite challenging to get food for people, get just the basic needs. I'm not sure if you're going to talk about that with your Medicaid enrollment that you're going for.
That's for SNAP, that's as of today. Yeah, the Medicaid stuff, I don't think that goes in until a little bit later, I thought. But I could be.
Yeah, I'm not sure, but the food.
Today is the SNAP stuff, so as of today, people will be thrown out for SNAP.
That's
It's
so sad,
there.
everything's so sad,
Yeah.
but anyway.
It's 40 hours a month. Wait, where is it?
What's the
20
work
hours.
requirement,
Yeah,
Marie?
right.
Yeah, they-
Yeah, right, you were right.
Marie,
Sorry?
oh, yeah, that's the trick. What is the work requirement for Medicaid or any of the programs now?
So for Medicaid to be fully funded free, believe the patient needs to be making less than $1,850 a month. And then there are more tiers after that where they would pay a copay. But that I think is the base salary requirement is 1,800 a month. And this is a really great point. It is drastically dropping and things are being cut, which is the reason that we're trying to push this program along. Because we know we're going to lose funding ultimately by the end of March 2027, and if not sooner. So we are trying to, once people are in the program, we're able to support them for 6 months. And we have the funding set aside for those patients that are in program. But so we're just trying to reach as many as possible and get them enrolled before those things are ultimately cut.
And. to
And we're
your
working
knowledge
on a
right
sustainability
now-
plan as well.
Okay, and to your knowledge right now, the funding body, I guess that's Health and Human Services from the federal side to the state. And then from the state to, I guess, the other streams that are local to the various
Yes.
cities.
Yeah,
Are they
state grant.
assured for how long? Hmm? But they still get some money from federal though.
Yeah.
But I understand Kathy Hochul, Governor Hochul's trying to set up a 3-state or 4-state health connection. They've done some announcing of it. We have to have more information on it.
Mhm.
And then there, of course, there's the New York Health Act that our committee and general board voted on approved. And there's that fight, which I guess will be more on a local and state level than federal right now. I'm not sure what she's. I don't want to get over what you don't have the information on, but
No. I don't have the information on that on here actually. It's more
you know, if it's
we've we've we have the funds and we're now trying to create a sustainability plan which will make them last as long as possible.
okay.
So as far as the Medicaid funding and SNAP funding, it's separate from that, the 1115 waiver. So
Mhm.
as the Medicaid requirements change, the people that are eligible for the program will also change with that. But let's say you're on Medicaid today, and before that gets cut in the future, you are set up with all of the referrals that you need to get pantry stocking and rental arrears. Then let's say a month from now, you're put off your Medicaid, you will have already received these services. So again, that's the big push that we're doing right now, just to make sure that we can help as many Medicaid members in New York as possible. Because ultimately, what the state wants to do does need to be oftentimes approved with federal government, and
Mhm.
there are a lot of concerns around that, of course.
I know there's still a connection with federal, even though it's state run.
Yes.
They have to abide by.
We're applying for a grant extension, and that's also going to need to be federally approved. So
Yeah,
we cross our fingers
yes.
and put in the work.
Okay. But at any rate, so you continue. Thank you for allowing those
Yeah, of
questions.
course. Thank you. That was it. So I will stop the share.
I had, you talked about enrollment, but how are you actively enrolling? Because when you first sent your request to present, I mentioned ALMS, the organization that had a pretty sizable seniors resource fair.
Mhm.
But according to the executive director, he had not heard from you, Anthony Michael, and that was just 2 Saturdays ago. So how are
Yeah.
you, because you wanted to do something right in front of the building, our building here?
Yes, I will still reach out to him if there's anything else going on. Unfortunately, we didn't have the staffing to cover that event that Saturday. Um, but as far as the building itself, what we're doing now is like designated resource days where we'll have our screeners and navigators come present, not present, like be present at on site at the building and screen people as they come in, or we can make appointments with them to do the screening. And that would be to assess their needs and then immediately get them set up with a patient care navigator that can help start to make their referrals. So right now we get a lot of our screenings online and through our phone number, just by community connections and handing that phone number out. But our voicemail has been really backed up, so we're trying to meet people in person so that we can get them the services that they need as quickly as possible and not wait on the phone calls back.
There are a lot of events, resource fairs, and health fairs, and people who are just having just entertainment available to them on the weekends. Various groups where you could just we get a lot of emails about events that are taking place. So maybe I can, not maybe, well, I'll try to do that and just send, but you have to follow up with them and just ask for the
Definitely,
table.
yes.
Yeah, but, that was a pretty sizable event, the one that I did mention, because I got the sense where you said you wanted to have a table. Those events might be very accommodating and provide you with more people. I'm not sure what our day-to-day kind of traffic is in front of this office. Ashley, what is your sense of people just passing?
Passing in our communion.
Yeah, just walking along the street here. This is kind of
Pretty busy.
relatively quiet.
Yeah.
It's busy. Well, not quiet in terms of the trains. And everything.
Well,
But
like there's
you heard a lot of
people that are
stories.
sore though, but when they're out, it's there's like a lot going on. Around like 3:30, it's very, very heavy.
Cause those are school kids,
Yeah.
right? Yeah, school kids. Well, you could try 3333 Broadway. We can put you in touch with someone, and they've oftentimes had tables in front of their complex. It's huge. It's like 5 huge buildings, and they're pretty much called a campus. About 5,000 people lives in those buildings total. So it's really some huge number. Maybe 3,000. I don't want to over exaggerate, but I know there are a lot of people.
Mhm.
Huge. But
No, that would be amazing.
and now's the time that we might be able to enroll. And I think you have to kind of let people know that something's coming to an end. And they know it's bad. In general, people know their situation is bad. But you may have to have signage and tables. Just one person sometimes, whoever, if you're really actively wanting to reach them, especially on a Saturday. Some people who have jobs may not want to work on a Saturday, but there are people who need your help.
Yes.
And then there's another housing organization, Broadway Housing Communities. Are you familiar with Broadway Housing? They're huge also. They have about 7 buildings.
I think that Broadway Housing is actually also in our network as well.
Yeah, they should definitely be in your network. I know there's no more housing. They are booked.
Yeah.
They're such a terrifically run organization.
Mhm.
Anyone else have ideas or suggestions?
Do you happen to have also a newsletter that you send out to the community?
How often does our newsletter come out? Monique is not here. I think she's gonna be working on
So
it.
far, there's only been 2, and we started in February.
There've been 2 starting from February.
Or
When's the next one?
January, I don't know. I don't know.
You don't think in June, July?
I'm not sure.
I know, I think at the last meeting, not the last one, the one before Monique mentioned being involved with it, she's not here. We do have a quorum though. Did you scratch off what cause I had you excused when you signed in, can you?
Yes, sir.
You said good, cause I.
Trying to make, I
Yeah.
told you I tried.
Yeah, you always do,
Yeah.
you're a real
Yeah,
champ,
yeah.
Liz. So we do have a quorum now, just so everyone knows, but, I'll see what we can just forward to you and maybe, cause she be put on our, we can see if you can get put on our, mailing list on our e-blast so that, when information goes out about events, flyers, you could, take a look at them and email and hopefully get a response back, cause I know there won't be phone numbers. But the email
That would be
itself
great.
might have a phone number.
Definitely. Please put me on the mailing list. Send anything my way.
And when does your campaign formally conclude?
March
Right.
31st, 2027.
March 31st and 2020. Okay.
Unless
Any
there
other-
is an extension.
Yeah, that's why I said we really have to be active on this, so let's see what the New York Health Act comes up with and what the November elections are about. And how they can change things for a lot of people. Any
Yes.
other questions or other? And if you would like to come back in September to tell us how everything is going, or whomever come back, that will be good, but can you put let's see, I'm pretty sure I have your email address, but if you
I'll pop it
drop
in the chat.
let's see, two others can probably, get the information, and then I have it from the email. Can you say it out loud, though? Can you just say it out loud for those of us sitting here?
Yes, my email is mkearns, KEARNS, @healthsolutions.org.
Health Solutions, all spelled out. Okay, .com or .org, okay. Thank you, Marie.
Thank
Thank you so much. Y'all have a rest of your good meeting.
Thank you. Okay, now what we could do, I have minutes, but what I wanna do is kind of go over them. Just look at them real quickly, and I haven't edited this is AI, and what I find with AI is that you still have to do a lot of editing. But at least it gets some sentences down, and sometimes their sentences don't really make sense, because they're, listening to our discussion, and they're trying to pull up whatever they can pull up, and maybe it's, for the most part, it's correct, but then there are other things that may not. And these are minutes from, the May meeting. And of course, it's not gonna get spelling correct. My name, just for everyone, LA capital QUITA. So let me say that, just so quickly to just go over it, if there's anything that stands out, as we continue to talk, I mean, I'll just break for a second. Shante and
I'm Barbara.
hi, Barbara. Shante, are you a member of the board, Barbara?
No.
Oh, okay. Public member, okay, so one day. So, it counts as friend if we this and everything. So that works. The Manhattan Borough president, for those people who are up for reappointment, had to commit to they kept saying it over and over and over again, that you're supposed to put in, board members are supposed to put in 16 hours a month. I'm sure most people don't do that. A lot do, you know. But they figured we should be able to do it with committee meetings. Your regular committee, and most of us have 2 committees. So right there, I guess that would be 8 hours. I'm sure it's not for most committees, but that's what they're saying. And they kept going over this. So I think they'll really be looking at some things this year. The general board, that would be another 4 hours. If you're on the executive committee, that's 4 hours. And I don't know where the other 4, if you're not on executive, would be. But they said 16 hours.
A lot of hours. Yeah.
Mhm. I guess projects you're, you know, to work on, like with our committee, we had the public health forum. And so most of the people put in it was from 10 to 4. Some people came in the afternoon, some, earlier. So they definitely got in 3 to 4 hours, I would say, from that. And generally each committee puts on a forum, or they should put on a forum to meet the public. I'm not sure that happens. I know arts and culture did the big event with the young people, that concert. Congratulations to Tina too. Had a great show of students, young people who came. I think she either said 156 or 176.
It was 156.
Close to
56.
150.
That's a great number. Yeah, we could have used those kids at our youth workshop, So that's why it's really good. I, try to reach out and let people know what we're doing, but sometimes it's kind of hard, or sometimes people don't know who they know. So I don't know where the kids came from, if they were the skating rink group. There's some other groups. There's a baseball league, kids.
Yeah, a lot of them I think were already from they were participants at Riverbank, State Park. Yeah.
See, that helps a lot.
They were from various parts, from East Harlem to North Noma. So what's the the one that's
Oh,
uptown?
no.
The North and Washington
Okay.
Heights and public schools were involved. It was a hodgepodge of
Mhm.
groups, and then
The public schools are hard. So I bet you it's mostly Riverbank. So of course they have public schools,
And they do a
but-
summer camp.
and
too.
summer camps and all. That's
They have
what
a lot of-
that we didn't tap into.
Yeah,
We didn't tap into that Riverbank,
yeah.
and that's really important. That's really good. Which, so but that was a good show. And did you go?
I was there.
Okay.
I was there early all day because I had my 2 nieces, and we was already skating for one of the songs for a few minutes, and I was beat. I couldn't take it anymore. I had seen them getting ready and everything, and they was coming across the bridge with their outfits, and they was geared up.
Yeah.
Yeah, but I was beat. I was out there already since 1 o'clock,
Yeah,
and it started at 7.
It started at 7, but we had
Yeah.
a report for like 4. I mean, and
yeah.
kids were
yes.
doing their sound checks around
Yeah.
from 5
Yes.
on.
I
Oh,
tried to
right.
played around in the whole thing. I got tired. I was like, oh boy.
It was.
But that was good. So that's what we're. Thank you guys,
Thank
and I
you.
and congratulations with the public health, but we still got to reach those schools, and it's so hard. I mean, the whole safety issues where the schools are like a lockdown. That makes it hard too, because the principals are hard to reach to get an appointment. The PTA representatives are even hard to reach. So we need to go to their meetings that are, parent association. And there are ways to get to them churches. This got to start early. So that's what, that's what we're going to have to do. And we did have a follow-up, and I have that down to a couple of things to follow up with, and we'll get to those. But meanwhile, anything outstanding in the recap, because of course, it's gonna have to be cleaned up, which I'll do, but we could vote on the concept of this right now. 1, 2, 3, 4, and then Jordan, if you had a chance to peek at it, if there's anything that's outstanding that you see now, tell me to flag it. Anything?
I don't think she has a thumb up.
Hey, Jordan.
She had a thumb, no, just saying yes, yes.
Oh, okay,
Good.
thumbs up.
Yep, all good.
Oh, good. Thanks, Jordan. Okay, so at least we have a vote on it, to go forward with this. And I will still email it out to you before the executive committee meets on June 11th. Vote to go forward. Any opposed, I should ask. Okay, vote to go forward with minutes, with formalizing minutes. As in recap. Okay. Now, at our, kind of like an announcement, I guess. At our last, executive committee meeting, I was ready to present the, anyway, I don't have it here, but I was ready to, present Heritage Health and Housing's request or for a resolution, a vote on a resolution to accompany their New York Main Street grant. Right before, right when that topic came up, one of our board members said, before we hear it or before we go forward, there's all of this hubbub about heritage in disarray and top executives leaving, et cetera, and that we should not entertain anything until that was squared away or straightened out. Anyone, was anyone else there? Did I get that all correct? But so it did not get voted on to go forward, to be presented at the last general board meeting. And so, because the funding that they're going after, New York State, and we would be voting on that, and then Heritage had, not reportedly, it's true, the chair had let their CEO go. That person got fired. When that person was fired, then the comptroller and medical director also left. These are all the top people. So who was going to be running this, and was it done with due process? And apparently there's legal action. This is really a big to do. The second thing that was presented is that the leadership, the current leadership, should come forward before the executive committee and present this grant. And not only that, but before presenting it, of course, let us hear from them in terms of what's happening. They're a very key institution, business in our community. They've been around definitely for more than 50 years and possibly more. They were incorporated under a different name in 1968. And of course, they had been functioning before that, because it takes time to get incorporated, but they were functioning. And I believe the incorporation papers came through in 1969. Full disclosure, I worked for Heritage as a consultant, first never as a volunteer, but as a consultant, and then hired. And then I developed their commercial revitalization program and brought forward about a number of grants. It was about, if I remember correctly, about 2 million in grants. 3 of the New York Main Street, one right after the other, because we It was a star, it was a banner agency servicing a lot of patients. I'm not sure how many visits, if they're at 6,000 visits, because, once you're there, you go, you can see other doctors. Had expanded their roster of doctors over the years, and people like their doctors. So it's really sad. According to the new leadership, no one has lost service. The current patients are being taken care of. But I'll let them tell their story. I'm going to recuse myself, but in this meeting, at least, I could mention that much about it. But primarily, they've been one of the prime institutions in our community. We have Ryan Health that has come in on a 135th Street now, but they were they were considered part of it even in their other location. And then there are some private doctors, but both Ryan and Heritage are FQHCs, federally qualified health centers, and that's major too. That's very difficult to come by. So they do get one or two. So this is, so we'll just have to see what's going on. So now you guys know, and I needed to say all that because we voted unanimously to go forward. Their representative, Patriana, I always forget Patriana's name is hyphenated, presented, they using some of the presentation for the building renovation that they presented to Parks and Landmarks Committee. So we really don't know the total truth. It's not that the organization is bad, but something's going on at this level. And when it's going on at this level, it affects everything. So, we shall see. And they have been invited to present at the current leadership at the June 11th Executive Committee meeting. Okay, so that's what I know thus far. The third thing is sort of in the form of an announcement as well. We talked about our youth workshop, and there was an opportunity to give our youth presenters another opportunity to meet with young people. I emailed something to you this evening, actually a thank you note from an event that was held on this past Saturday. But I got a call from Lois Penny, who founded New York City for Youth, maybe 2 or 3 years, maybe 3 years ago. And for a couple of years, she's been doing a program with another organization. I'm not sure if this year's organization was the same as last year. I don't think it was, but this year it was with Olivia Zhang. She's a youth influencer. Have you heard her name?
No.
All of these influencers, but the young people, I'm not sure if as young as 14, but certainly as old as 24, know about her. And so Lois called because they had heard about our public health forum and all good stuff, actually, which it was really good. You heard it last time too, and everybody on this committee worked at that. So we're very we had full turnout, and other committees have had that too, where I visited. But anyway, they heard about it, that it was at City College, and they were looking for space. I invited her to come to a debriefing meeting, and hey, Edwin. And so I invited her to come to a debrief. Okay, welcome. And she did, where Columbia University was represented, their person from the School of Public Affairs, another one from Government Community Affairs, Dr. Gomez, who's with Connect at, CUNY, and that's connected with CUNY School of Medicine. Um, Monique was there, and there were a couple other, oh, and of course Wendy, who is with Tall Omega Charitable Trust. So we listened to her project and it sounded exciting. They had all of these kids. They even got to a number they thought like maybe 500 were coming. Well, it was like a great number, like 125. That's excellent. But you know how we get when we get the word out, because Olivia Zhang is very popular with young people. So, but they had a terrific turnout where she talked. At any rate, they would not have gotten the location without our involvement. Having heard about City College, by inviting her to that meeting, Dr. Gomez said, well, Peter, you and I know Nicole Bay, let's get Nicole involved, see if they, because Columbia University has and medical center have terrific, fantastic space. They have space, not that they advertise, because they have graduation ceremonies, they have medical presentations, they really need their gathering space. But we got their alumni auditorium, which holds 600 something people for this past Saturday. They found grants to for the food. Victor was involved with our initial meetings also. I didn't mention that. So basically, we were sort of a sponsor because they carried the community board's name with it. And the Tall Omega had about 14, 15, including some parents that came. And the young people who left, I said, how was it? They said it was awesome. So Wendy's from the Tall Omega Charitable Trust. So we really have to get it out. They have a terrific program, and so was Olivia Zhang's. And they apparently wrote notes to kids with cancer that will go out to hospitals. That was one of the projects inside. So it really was good. The food, big spread. It was really good. So if you look at your email, you'll see something from me, and there will be a few photos. All the kids had to sign a waiver for use of the photos. And I didn't really take photos on the inside, so maybe the photos that you see from this email, because I CC'd our committee. I CC'd the main debriefing group from the Public Health Forum, and then I put the committee names, the 6 of us, and I wrote the letters. You'll see it. You know, I don't hesitate to invite you. In addition, so anyway, that was it. So that gives our Making It Through program a boost for the West Harlem Development Corporation grant. I don't know if New York NYC for Youth is applying for West Harlem Development Grant, but I think they get a grant from somewhere, maybe from the state. And these young people came from a few of them from out of state because they heard about it there. They tuned into Olivia Zhang, and then from around the state as well. So it was a nice, very respectable outcome for both of them. And the Making It Through program was just an hour, but there was food beforehand. The other program was a full, theirs was like 1 to 6. So they had about 3 segments and food. But we helped because of our connection with Nicole Bain. I'm saying all of us helped them get their program off the ground. And Lois is a member of community. She's not a member of the community board, but she's in this district. And so that really looks good for us as well. So I'm
Regularly, well, she used to regularly attend the housing.
Yes.
And she's done a lot of programming and I remember she would put on even law forums and things like that.
Yeah.
Estate planning, like at Chase.
Exactly, and I missed the one at the bank
Oh, yeah,
where
I went to that one.
yeah,
Really good.
estate, anything with estate planning,
Yeah,
very important for us to really get into. So that was,
but she was very active, with the 1727, that hamster.
yes,
I think she's a real listening on the side too as well.
Yeah, she owns real estate, and, you know, so she knows what's
She's
going
very
on.
Mhm.
And so she plugged into really something very important with NYC for you.
Yeah.
So I'm very pleased we were able to help with that. And so you'll see that letter, and the photos in your email.
I just looked at them, they're great.
Okay,
Thank
okay.
you for sending.
And I didn't do like real close-ups, even though they, you know, you can do that, and they signed a waiver, you know. So, that's on that score, and that's, the heritage. So the other thing, I hope as we go into the new year, that you guys will be part of this committee. I hope that I will continue to be part. I'm not sure what's going on. Is the election this? I should know, because I chaired one year. Is it like, do you know? Maybe the election's not till next year.
Well, for what?
Community board,
officers?
our community board.
It was it was in the fall, I know, my first meeting, I mean, it was last summer.
Yeah, one other time we did have to do it in the fall.
At City Council.
Yeah.
We did, because I think
That was my
there is
first
one
meeting.
every. I think there is every year.
It was in June. Oh.
Yeah, because I chaired it. But it- yeah, but I've done it like 5 times. I'm like, this was so strange because I don't remember. They're supposed to ask for it back in like March or something.
For nominations?
Not, yeah,
So maybe it's not every year, is that what you're saying?
I think
People
it
serve
is
multiple
every year.
terms?
I don't
Also,
remember.
was annually.
Oh,
Yeah, it's my thinking. I should know that in their bylaws.
Here.
But it didn't, maybe someone was supposed to bring it up, and I think I wasn't at that one meeting, and usually it's done, they select committee in March.
Well, I know they had to narrow out those who, like in December, right?
Yeah.
So then bringing it into the new year, January, I was assuming that they were going to have elections spring of 2026.
It is supposed to be spring, it's supposed to take place May, June,
Oh, okay.
so I don't know what's coming up at this,
And that should have been done, this should be done at this general election then.
Exactly,
Yeah.
and they may, now there
In
is
June.
one time in the past where it did get scrambled, everything just got from the floor. It was like, I think it was in June, and then they held off the election of like the secretary or other for the fall because they couldn't find someone to run to that office. So that one was delayed for fall, but there was election. So we'll see. We'll, you know, and then maybe the other thing could be, I'm not sure how many new people were scheduled to come in with the new Manhattan Borough Board, and, you know, I'm not sure how many people are not part, you know, who, what is it, termed out or may have left. There's always a big number that leaves, you know, at the end of the year. And so that could be a factor also, you know. So we'll see what happens in June. But I'm just saying all that to say that, you know, I think it's been terrific working with the group. I think there's so many things we can do. It's a big topic. With the public health forum, the follow-up that I'd like to see, regardless of what is happening, and I'm working on it. The young man that called tonight that I couldn't talk to was recommended to correct out, not correct, edit our video of each of the presentations. And I know that Jordan had mentioned, why don't you get a student, find somebody, you know, who knows this stuff. And so it's taken a little while, but he called tonight. It was another student who recommended him. And so I'm going to talk to him. And he was supposed to have called me back on Saturday. And what I would like to do, this is ambitious. The gentleman who was the Oscar winner, who won an Oscar, who's on our committee. What's his
Oh,
name?
team.
The team.
It's not Mateen, is it?
Wait,
He
I don't think
won
he's
an
on the
Oscar and he's on the
he's like
people.
white, shortish,
Uh-huh.
but he's not. I don't think he's on the board anymore.
Wow, he's not.
No, he resigned like
A few months in. See, that's the way it happens, because it's probably more work than they imagine. But you know what? I would still like to have his name because I think he's on our list.
the team. Sorry,
Yes.
He resigned? I thought I saw him last.
No, not Martine's on the board. He shares or co-chairs housing. Martine.
No. That's
That's David and Martine. They co-chair housing.
you're
That
right.
seems
Yeah,
like
but
kind
you
of
know,
a
I
tall
know-
guy,
yeah.
kind of big.
The
Right.
one you described the other guy, he's short. He's sort of short.
I don't think I know this one.
He's it was announced quite some fanfare, in terms of the reception that he got, that he had won an Oscar. He was on the arts committee.
What did he win an Oscar for?
I don't remember. I don't remember what he won it for. It was in probably what category? You remember what category he won his? Hi, Isabel.
I think he was like producer or director.
Oh, he was a producer. See, he would be great. Okay, Shantae, thanks for sitting in.
Yeah, there you go.
Isabel, we sent you to sign as one of our guests, okay, over there.
I did, yes,
Okay.
thank you.
Yeah, so he's producer director to see if he wouldn't mind, say, just assisting this young person. I think that would be great. He might like that. If he was willing, maybe he got a big film to work on.
He's a professor. So I think he's like, I don't know where he is now, but most recently he was like abroad teaching.
Yeah, see, that's
Yeah.
probably what happened. But if you think of his name,
Yeah, I'm trying to
But
find
he's on the
it.
arts committee?
he signed up for the Arts
You
and
mean
Culture
Milton?
Committee.
Milton.
You're describing someone, but then the boy, then she said big guy, and then that threw me off.
No.
No.
Milton, yeah, Milton.
Mateen is, yeah, what's
He'll be back, he's in Poland, but he actually participated on our calls, the time zone was
Really?
crazy for him. He was, he stayed on board, he was so.
so
excited.
maybe just a leave of absence.
Yeah, he'll be back, he's coming back in June.
He's
Yeah.
he participates, he helps, but he's not officially on the board.
Oh,
like a
wow.
public
Oh, that would be great then.
Yeah.
Is he on the board list?
What's his last name?
Justice, Milton.
No, so if he's not
Yeah.
on the board, he was not gonna be on the list then.
Yeah.
Who has his number? We don't have to say it out loud now,
Yeah.
in case he doesn't want somebody.
But,
But,
Tina
yeah, if you,
has his number.
who?
Tina Lumley.
Okay,
Definitely.
I can reach Tina, but it'd be good if I could get it from, Tina's out. Cause I need to try to call him, leave him a message, cause it might take him 2 days to get back. And if I could tell Brian, we have an Oscar-winning producer, director who works with us, and he would probably love that. Yeah, it would be a great match, And he could probably get CEU credit for it. We have, I think, making it through helps provide CEU credits. Probably Dr. Gomez through her Connect, I think it's called Connect or Community program could offer CEU credit. That would be for the student, and then, Milton would get personal gratification of helping to pull this off. So that's in the works. And then 250 years doesn't end on July 4th. We still have the whole year to celebrate 250. So I talked to Nicole because the event Saturday was so wonderful. But we have to start now, and it would be great if everyone here participated. And I know you will, because you guys have ideas, and they're, just because Cameron and I are coaches doesn't mean that you guys, you could come up with resolutions and other things, but here's one of the ideas. Is basically a 3-day event that we would start planning, look at this summer. We tossed around some ideas.
Is this for the health forum?
For 3 days. where that Thursday, it could be a Friday, but we're thinking that Thursday could be sort of like a science fair, but not calling it a science fair, but where there are students in this district. They can come from other districts, but they may have biology projects, some new concept or idea that they think could help assuage pain or provide some form of healing. Be part of us, they may be part of a science technology, what is it, STEM, science, technology, engineering and math. So, I mean, because we're like, there's City College has a high school connected to it. And I think that's their emphasis. A. Philip Randolph School. Those kids are really sharp. Then there are other programs that have, they have science projects or other. And Dr. Christine Marizzi, who's part of this committee, she hasn't participated much this year, but she's in the bio bus. And her kids really present amazing work. They come from these area schools. And if you've ever seen their projects, I mean, they're amazing. Have you actually gone over there?
I haven't. No, I want to. She came to my center yesterday. That's why it's fresh in
Amazing,
my
amazing.
brain.
And one year, it wasn't last year, it was 2 years ago, she had about 10 of them do presentations at the Academy of Medicine on Fifth Avenue. You were listening to future doctors, um, what's the award? Oh my goodness. Anyone with a big science award, Nobel Prize for chemistry, or or environmental science. Because they get trained in the whole process, and they were juniors, sophomores, and juniors, and some seniors. So that would be one day. We're looking at that for Thursday, but again, we'd have to start it early. And we would want the spring, of course. Then Friday, Anthony Michael, fantastic. He's the one that helped find the student for the video. He wants to do a festival. So I'm thinking that maybe, I skipped. Maybe the actual health forum could be on that Friday. I attended a clinical seminar, and this one doctor, the presenter, talked about her forum. They invited 20 professors, and that was their forum. And it was like amazing. She was amazing to hear her speak, dealing with public health equity. We still want the public, but basically invite these key people, and then a book or some message with some consistency and of import comes out of that. And then on that Saturday could be the Festival of Health, where maybe there are kids, from our district, families, kids that may be dealing with some disability or handicap or something that shortchanges them a bit, but where they could be invited in and have fun. And food and nutrition, where cooking takes place, and that would be perhaps at the Haven Center, right next door, this open area. You can't see the water from there, but it's a nice open area like a garden, and that would be the Festival of Health. So that's the 3 days. You guys are hearing it here. Do you like it?
Yeah, interesting.
It's big, but I think if we start this summer, and then there's buy-in from the person who headed up this, getting our space and everything, is really into it. Anthony, who had a fabulous seniors resource fair, came up with some ideas. He's terrific. He bought into it. So the people are there. We can do it. And that brings us to Isabel. She generally,
Hello. I'm so sorry.
Elizabeth.
I was teaching.
Okay, well,
I was
Isabel participated in the youth workshop. She had everyone there. They were mostly adults, but with these dance moves. I don't know if they were also yoga moves, but she is fabulous and helps run the, what is it?
Harlem
Brain,
Brain.
Harlem Brain. So, just briefly tell us something,
Yes.
about what you do. And it all ties into health, even though she sits in arts and culture because of her dance and
Yes,
the arts is health
committee.
also.
I'm always with the youth committee, but I do
Yeah,
want
because
to
we learned about
stay
to do Shanika.
engaged. Right, right.
Shanika Wilson, yes.
But I do want to offer it here as well, especially like if there are folks who are interested in natural health and preventive health and holistic health, any organizations doing that kind of work or who want to expand health in this way. Yeah. So I'll give you guys one of these.
Mm-hmm.
But
And do you have a
basically-
flyer we could, for those who are not
Yeah.
here and for the larger group, it could be disseminated. Everyone has to check their emails because sometimes I feel like I'm sending a whole bunch of email out. And then later, I know that the office sends out, some will be repeated, others will be very different email.
So you're welcome.
Related. And Edwin, when I get something from him, he has fantastic different resource of information too. And so I try to get that out to people.
Great. Yeah, so essentially we have the center on 7th Avenue at Clayton between 131st and 132nd. And we have classes every day. You can see the schedule here.
Cool.
So one way to participate is through the classes as a member. This has like a low cost, but it does have a cost. But
What is the
otherwise,
cost?
we have this free open class once a month that you can send anybody in the community. It's the fourth Saturday of each month. And then we also provide a 10-month scholarship to young people in the community that want to be more of a leader, and help others and are interested in holistic methods and preventive health methods, and leadership in that way. So this year we have 8 beautiful participants and they're receiving all these classes during 10 months and then also education on Saturdays, and also they learn how to teach. They do 5 classes, they practice 5 classes. So yeah, I feel very hopeful about this one, about the scholarship program. This is the second cohort we do this year. And they're fantastic. They're really great from the community. And they're all like in mental health or some are artists. One is like in construction. So they're in different fields, but the idea is that they apply these teachings and these learnings wherever they are and expand the benefits of our program and practice through their own. It's sort of like a multiplier effect that we're looking for.
So if you don't get a scholarship, how much would that same?
Yeah, the
Is it
membership,
10 months?
otherwise it's $99 a month. And you can come to these classes.
Wherein on one hand, it does not sound expensive, but it can be.
Yeah, right. I know.
So 1 month, how many classes would it be? 4 days?
Yes, so this
Any
is
of 4? I think I'm game.
Well, so it's unlimited classes for the 99.
so 99 gives 2 a week.
Ah, okay,
Days.
I see, unlimited is money.
Yeah. And then
What do you do for weight loss?
I'm sorry.
What do you do for the weight loss?
For the 7 a.m., it's a little bit more physical, I would say. I do a lot of core strengthening, but always with energy principles. So it's not like where in the gym you would pretty much just work out your muscles. This combines breath and movement and body tapping and like holding a posture, but it is more physical than the other ones. You have to hold your legs up and things like that. But everybody can do it. So it's losing weight not in a conventional way. It's more like by spending energy. It's a little bit different. It's very mental. Because in the end, everything is mental. So
Yeah.
right. Yes.
What are the ages of your cohorts for the youth?
For the youth program, they're like in their 20s, pretty much like young adults.
Okay.
Young adults.
Okay.
They're college students or already like in their beginning stages of their working.
And about how many attend, how large is each class? Say, the Tai
For these
Chi.
daily classes, they're quite like intimate groups, maybe like six average, I would say is
Not
six.
bad.
Yeah, yeah. Cause this is like every day. The free open community class, it is quite big. It's quite popular. I think the word of mouth kind of it
Yeah.
spread. So every time we have, a good group, like fill up the whole room. 20 to 30.
It's amazing. I think people are really into
Yes.
exercising more. Our community, particularly I say our community,
And then the
in this
mind-body
area.
connection. I see there's more and more interest and awareness and experience, energy. Like it doesn't seem so foreign anymore.
Right,
Well,
right.
It used to be like more
Well, they're making a
challenging
connection.
to make it the message go across, but it's getting like more known. And then last year, the project we have with West Harlem Development Corporation at Librando, it had very good results. We applied some research to see like specifically some indicators and they all went up. So it's really good. Yeah. Like their stress levels, their emotional regulation, their ability to adapt and change.
You did like pre-post?
Yeah, pre-post, yeah, surveys.
What's that?
You just test somebody before you administer or anything.
Yeah.
Test
We do
them
9
after.
sessions, and so before the 9 sessions, they fill in a questionnaire with they're publicly available scales like Bandura, and they're like social emotional scales that measure. And then after that, we do 9 classes, and then at the end, the same scales, and then you can compare statistically.
You don't do it midway though.
No, no.
Either beginning and end.
Yeah, because it's
So
a
you
short
see.
program. It's 9 weeks. So
And that's called what? The one that do all the programs do that, or just this one particular one you're talking about?
this is not, these are like the classes at the center. And then we also go into the school, Philip Randolph, with the support of West Harlem Development Corporation. And we do a curriculum that's not here, but it does include some of these techniques, the practice, but the curriculum is like each session, each of those 9 sessions focuses on a theme. So like the first one would be the mind-body connection, have them understand how it's not separate things, how like they're in the classroom and their body's there, their mind should also be there, but it's like half there, half not. So we kind of understand like why this is happening and when they're 100% and what is the gap. They start to see themselves more clearly in this way. Because sometimes the kids are like, they don't understand themselves in that way. Like, how come I'm not like here? They just think it's normal or there's nothing much to do about it. They're just spaced out. But like, there's a lot that can be trained in terms of attention. And, that's not like lecturing them, but having them actually feel through experience and energy, like tap and come to their bodies. So that's the first theme, mind body connection. Then we do like energy, like what is energy, how it should flow, meridian channels, and have them like press and breathe and feel how it can circulate, things like that. Yeah.
Edwin has his hand up. Yes, Edwin.
Oh, yes.
Hi, I just, it sounds like a great program. I just had a question in regards to the study that you guys are doing. Is that a study you guys are doing? If I heard that correctly, the pre and post testing?
Yes. It's more like an evaluation. I wouldn't say it's like
Yeah.
a study.
So is that, IRB approved?
Oh, right. It's more like an evaluation.
So I think that just for human subject, we have to be careful when we use these tools. And when we're dealing with vulnerable population, the population that you have described, they're considered vulnerable. And they can have good intention, but this is precisely why when such, tools are used, unintended consequences can happen to them, even if the meaning is well intended. And I think
Uh-huh.
that, this is something that should be considered to have human subject look at it if the intention, when you have these tools and do pre and post and evaluation, that is something that we have to pay attention to.
Yes, thank you. Thank you for saying that.
What can you do to, I guess, be recognized by,
It's
whatever
a process,
institute?
yeah, through a university.
Yeah.
Yeah.
Yeah,
It's
typically this is very simple. She'll have to, Colombia probably will be very happy to do this. You have also here Mel, the Sophie Davis School. But this is
And
to
Gomez likes this kind of thing too,
um
so
this is
she.
this is to yeah, this is to make sure you protect the human subject because um, you know, many studies have been done where, unintended consequences have happened to the subjects.
Yeah.
This isn't really research. I mean, I think that's why this becomes not really an IRB issue, because you're not doing this to publish a paper, or you're not doing this for the sake of research. You're
Ye-
doing it
like,
as a
like
interventionist.
improving.
Yeah.
You delivering the program, it's like taking a yoga class, and before you go into your yoga
Yeah,
class, like,
something
how are you
Mhm.
feeling today? Great. And then
we can
afterwards,
improve.
yeah, so I don't
But
think this is research purposes, thus it doesn't really qualify as research. It is human
but
subjects.
but
humans, but
she's using validated tools, right? That's what I heard that they were using.
yeah, but it still doesn't count as research, I think.
Yeah.
It's not for research purposes.
Right. Yeah, thank you for clarifying that. But it's good to also.
Yeah,
be
that's
aware
certainly
of
important
all
to keep
these
in
things,
mind.
And,
Yeah,
and,
yeah.
and it could be a good, way.
But it's data that's being collected, and that data is there that one can have access to. And that's where, IRB comes in because whatever that data is, there, you have is the research not being done now, but that's data that was collected on these subjects.
Uh-huh.
You know, it might be a good thing to explore because
Yeah.
it could up,
Anyhow,
because you guys get a lot of, is that Ibrea?
Yes.
You get a lot of good publicity. Why not up the ante
Yeah.
and
We have
look
done it
into
in the
doing
past,
that?
actually. Have done it. But yeah, it's also like capacity and resources, but.
But there might
For
be
us,
something
it's very helpful just to see, and it's anonymous, and they give their consent, and it's just a way to kind of,
So
yeah.
that's the thing. When
See.
you get when you get consent has to be IRB approved, and that in this type of structure that you describe in.
Uh-huh.
Yeah, and look, partnering with an institution. Look, you have also the social work school here at Columbia. You have also Hunter. They do a lot of this work, and I think that they would love to partner with you, and
Yeah.
and just make sure that this data, that you're collecting, which is very valuable, can be also apply and use in ways to come back and bring more to the community.
Yeah, thank you.
And it doesn't hurt to start now, even though you may be feeling like you're understaffed, but there could be a way connected with, say, Connect, Dr. Gomez, that's connected to City College and the CUNY School of Medicine.
Yeah.
I wouldn't mind two of you
Okay,
talking and start thinking about it. Thanks, Ed, when I
Another question.
Yes, sure.
The April grant program, which department did it flow? Was it humanities or?
Humanities,
So
yeah.
that's here,
Yes, awesome, Miss Westerback.
that's who we work with for our dance
Nice.
program. But that's why when you mention it, it says Kiara, because that's, she's very much.
She's wonderful,
Yeah.
yes,
Yeah.
yes.
So
Yeah, I've
that's
been
great.
working with her many years.
It's a nice connection. I
Yes,
talk more about it.
yes, of course.
and it's called Harlem Brain because of mind and body.
Yes,
Okay.
yes.
And I know that also NYU is very interested in what you're doing, the social work school there too.
Deborah Levine. Oh, wait, School of
No, the
Social.
School of Social Work at NYU also. They're very good.
Oh, yes.
You know someone there?
I know the department. Yeah.
On Saturday, Nicole, the person we were talking about, she's with the School of Public Health.
Mm-hmm.
said that a lot of times they love partnering with other universities. They're not as, that, they're competitive, yes, but in a different kind of way. They also like doing projects together. So depending on what's what, so that's a good idea too.
Yeah,
NYU,
it can it can offload a lot of the work that you're doing. You might have a PhD student who is like probably looking into this and take this
Yes.
whole project off your hand and just deliver you some of the outcomes that you're looking for.
It's all to your credit.
Yeah.
And some of these schools may even be in a position to give, Edwin I'm glad he's always saying something to make us think. It's harder, but there might also be a grant for you
Yeah, for the research component, yeah.
as an entity, I'm not sure if you're, it's a consultancy or is it a group, Harlem Brain and IBREA?
It's
IBREA is a
nonprofit, it's a
foundation.
nonprofit,
Uh-huh.
yeah.
There
And
might
Harlem Brain
be-
is a DBA, so it's really agree.
Yeah, there could be something there,
A grant,
it's just
yeah.
making the
Yeah,
connection.
For now, yeah, it's a little bit stretch to make that kind of bigger.
But now is the
it's
time
it's a-
because
it's a definitely we would like to, yeah.
Because I think, well, we were talking to Nicole about on Saturday. We're supposed to start meeting together as a group, and I think it would be good to add to that this 3-day project because they will start to look at the funding and how they're going to spend their monies.
Yeah,
And she's very resourceful in terms of where there's other possibilities.
great. Okay, wonderful.
So, Edwin, you always put us on to something. We have a lot of good people around us. Put all these heads together, and then, like here you are. Look what happened. You're coming for the arts committee, ended up in health, and perhaps an opportunity.
No, and nobody better than us to tell these stories like it's happening. And you have people that are, writing about it, but she's doing the work. Somebody can, put that story together and, and help the community.
I'm definitely doing the work.
Yeah. I'm interested in signing up.
That's wonderful. Thank you.
Okay. Thank you, Edward. Thank you, Isabel.
You're welcome.
Isabella.
Well,
Oh, I just said correctly.
yes, you did it.
Okay. So we'll be in touch with you. But
Yes.
we've talked on the phone, but I want you to, just give me your information again.
Yes.
And my friend over here who's not a member of the community, but you have Milton's.
I have Milton's email address, because I don't think.
Oh, that'd be great.
Yeah, it's really easy.
Okay.
Milton Justice at me.com.
Okay. At me.com. Okay. Fantastic. Okay. And so Linda, you may be involved with this too from a community standpoint. Any of you can, but I know that you got involved with it was so great that you knew about that classification and how the university system was looking to take away the professional status. Yeah, to some positions, nursing and social work and teaching. So
Yeah, so the Trump administration is removing those disciplines from professional classification, meaning that you cannot get loans over $60,000 for the life of the program. So like doctors are considered professionals, and so when they go to medical school, you can get loans. So anyone who is not in a professional discipline, you can no longer get loans, parental plus loans, which is how most people finance their graduate education. So it's a huge issue for professional schools, for students, particularly for students from marginalized backgrounds to go into these programs to serve their communities. It's a huge issue, particularly.
And then I helped on a resolution that had been presented by Deborah Levine at
Change the
CUNY
world.
School of Social Work, and it was terrific, and she knew about it, she really helped pull that off. But we don't know what happened.
Well, we know that nothing, I mean, the administration's going
So that
forward
means
with
we
it.
gotta push, which is one of the things, we can look at doing, I think, for September, maybe over the summer, some assignments, because we've done so many resolutions, but what of them? You know what I
Like
mean?
get some sort
It's
of evaluation.
accountability,
Right, right, the follow-up.
you know, what the follow. So we have, I think we're up to probably close to 40 resolutions since January 2022. And I use that date because that's when I was asked to be co-chair, thanks to Edwin, when he chaired the committee for, Edwin chaired for about 6 years. And he really pushed us to do what we should be doing, that is resolutions, looking at what's affecting our communities,
Yeah.
policies. And we gotta, and oftentimes in advance of their becoming recognized as a problem. And so we, you know, thanks to him, and then we got, other people started bringing resolutions in, and it's important that we do that. Because in doing the resolutions, we educate people. But again, the key thing is how do we have to really show having some influence or power in that we gotta be accountable to our own people.
Yeah.
When I say our, now I'm talking broadly, the community. Not necessarily just racial people, racial part is big, but you know, just how do we make this a stronger, more stable,
Yeah.
healthier community?
Right.
You know, and it's through the resolutions, the thinking that goes behind it, and
then following up.
and really going at and really getting our legislators to fight for us. We have to really fight for ourselves, but we have to make them see the importance of it too, and have them fight and make it law. And therefore some money gets attached to it and they start doing it. But then the accountability never ends. Because look at, you know, DEP, there's so many things that are law, but they don't enforce it. Not because they don't want to, but there's so much out there and they have a small staff, and you know, how are they gonna support it? So anyway, so there's a lot of work to be done, but that's one of the things, how do you guys feel about that? It means work, you'll get those 16 hours in for sure. You know, so anyway, but I think that's something we could do and be able to have something to show for it, you know, if they succeed.
Yes.
And you're always asked, if you reapply, what did you do? What work did you do? Some of you are new, but you'll see it. And then it gives you a real action item, you know, of work. And then the community will sometimes ask, well, we need this, and, you know, can you help us do this? Or it's important. It's important. Thank you again, Isabel.
Thank
And
you.
thank you, my friend over there, for coming and visiting with
There's
us.
no accidents that I.
Yes, I'm happy to meet
Pop
you.
that hill from St. Nicholas to the park.
No,
Yeah,
that's about
okay.
it. You know what? I'm gonna go to the hill. I wanna see what's happening.
Yeah, I'd love to talk more about.
Yeah.
About operations, yeah.
So you have to visit again because
We did the Lindy Hop. We. 2020.
well, the arts is health also. Music is health. The arts. So we have to really just find a way.
Yeah, music is health, that's true.
Yeah, to blend
It's
all
a
of that
healing
soothing, calming.
Yeah, yeah,
Dance helps to get oxygen, you know, out there up to the brain.
yes. We
helps.
also do lots of body movement and vibration and then use sound. Yeah, it's very interesting. Yeah, it's very.
So any new business or well, we dealt with some old business.
Laquita,
And
do we have a contact at the DEP? I know it was
Have-
Humberto before. Is there somebody else?
a contact with BET, you said?
No,
Oh,
DEP.
DEP. Not a new one, but there should be with the new administration, there might be someone key. Wait a minute, Yeah, I went to a presentation on last, Umberto is probably still there, but there's another guy.
Okay.
I was invited to a presentation at, it was in the same, no, it's not. The people who developed the Tasty building, once it
Mm-hmm.
was torn down, it's now called the Tasty Lab building.
Okay.
And they were there and they invited us. Victor was there, I was there. Seems like another Community 9 board person came. Um, yeah, and he was the executive vice president. And he wants to do what he was AI focused, but he also was focused on technology generally in this area to help. And there's a certain way to do it where it can build jobs and not be overwhelming into
Because
something that you don't like.
since DEP holds a jurisdiction for noise, that is the number one complaint that we have. You know, and it would be nice to know who's that person in our community board who we can contact.
Okay, I have that person's name somewhere because I
Okay.
heard him speak. And I didn't put it together then because everybody was going after him. I did talk to him and say, we'd like for you to come to our committee where we've had certain issues. He said yes, he was willing. That was maybe it was May 18th. Yeah. Innovation Triangle, West Harlem, Tasty Lab. I think it's a anyway, oh goodness. I have a lot of other names here, but I don't have his name, but there's a whole group of people, even one who used to be a member of the community board, her last name is Yu. I missed her when she left. Sam Sia with Harlem Biospace. Anyway, yes, I'll get his name again. But he was with he was with Economic Development Corporation, but there was something related to DEP with that. So we'll find him. We'll find him. Let me change that. That was EDC. But we also need some DEP again. Maybe Umberto is our first line of contact because we can reach him, you know. But we'll see if there's someone else with the new administration as well. Any other old business or? Okay, so it is now 8:16 p.m. to everyone's satisfaction, I'm sure. We can entertain a motion to adjourn.
I would like to move that.
Okay, is there a second? Probably unanimous consent, right? You're supposed to ask for a unanimous consent list.
Yeah, we're unanimous.
Yeah, well, this is.
I'm just tired. It was a real.
I'm teasing because that's Walter's usually the one. He's not in this meeting, but he's like.
Yeah, but I told you I was
somebody-
gonna try. But I gotta go back and do
Unanimous
something
consent.
tonight, so I'll do that.
Yeah, and thank you. Okay, thanks everybody for coming.
Very.
And we'll see you, our next meeting is September 14th, of course, it's not the first Monday, that's Labor Day. It could be on a Tuesday afterwards, but I kind of think people come, if they do go away, I don't know if that really works that well.
Yeah.
So the Monday that we would meet is September 14th. I think Arts and Culture is meeting that Tuesday though, aren't they?
Yeah, I think we're doing that Tuesday. I'll find out exactly.
Yeah.
I'll find out.
Mm-hmm. So there'll be no conflict in terms of location unless there's another group that meets on the 14th. Thanks, everybody.
Thank you very much.
Do you live in New Jersey, Lana?
No, I live here, but I work in New Jersey. I work in
I knew
Rutgers.
such a
Yeah.
Jersey connection.